I was quite surprised to find that I was asked to give some lectures at this conference. I brought a laptop with me with all my talks, and then when I arrived I was asked to give some talks. One was on new bearings, so I do apologize to everybody who's turned up, just in case they were trying to get a talk on new bearings. I'm just going to talk a little bit about biomechanics and why perhaps rotating platforms offer advantages in biomechanics. It's a slightly different take on what we talked about earlier, that not all mobile bearings are equal. So I hope you find that interesting too. This is just another view of my hometown. It was part of the center of the Industrial Revolution in the 1800s, and we exported coal and steel to a lot of the developing world. The docks in Cardiff became derelict, and when I was a child they were not a nice place to be, but now it's a beautiful part of our city. The golden armadillo in the background is our new art centre, which houses our opera house. 25% of the Knee Society score is attributable to flexion, and a patient's range will really depend on, as you've seen, the pre-op range, their pain, what sort of rehab they undergo, and it may have an influence by implant design and also by technique, as you perhaps already heard. And there are significant ethnic issues. In the UK, not many people squat to cook, squat for toilet, but a lot of people cycle. A lot of people need to get out of a chair unaided, and a lot of my patients want to go skiing in the Alps. So all these patients will demand significant flexion, but for different reasons. And I think it's important biomechanically to realize that the knee is a rotating hinge, and that there is a significant amount of tibial and femoral rotation during the gait cycle, in excess of 10 degrees. And that there are also significant twisting forces applied to the knee during gait. As you can see just before toe off, there's a significant torque applied to the knee. And if you look at motions of the knee compared to flexion and extension with AP translation and internal and external rotation, there are no straight lines on any of these graphs. So there are large swings in position of the knee through different parts of the gait cycle. So it just emphasizes to me really that the knee is a rotating hinge. And we've already found out that the historical failure mode of ultra-high molecular weight polyethylene was delamination, and that the expected failure mode of modern total knee replacement is going to be wear debris-induced osteolysis, which results from subsurface delamination and wear of knee replacements. And the wear of polyethylene is dependent on the kinematics of the knee, the design and the materials, and obviously how well you put them in, as you've heard from the navigating surgeons that have spoken this morning. You've already seen these slides. Just to re-emphasize that ultra-high molecular weight polyethylene will actually strengthen in the direction of force and will weaken in the opposite direction, and that multidirectional motion will accelerate wear and monodirectional motion will reduce wear. And this is a critical slide, and I make no apologies for showing this in both my talks this morning. You'll see that multidirectional motion of the femoral component relative to the tibial bearing surface in a fixed bearing total knee replacement will cause increased wear, because you double the amount of internal and external rotation and AP displacement, and that will produce a 5-fold increase in wear. So the more IR and AP displacement you get, if you double it, you get 5-fold increase in wear rate, so a significant generation of wear debris. And wear is increased by this cross shear of polyethylene. And this has obviously got implications for our younger patients and our higher demand patients. And I'm struck by the last speaker with a phenomenal range of motion preoperatively that his patients had. None of my patients have that preoperatively. You've already seen this slide. And implant design has an effect on wear. We need to think about the kinematics of fixed bearing and mobile bearing knees. In a fixed bearing knee, you're going to have multidirectional motion of the femoral component relative to the upper surface of the bearing. And in an RP mobile bearing, you're going to get decoupling of the forces And this is a critical phrase, the decoupling of the forces. So you're going to get, on the undersurface of the polyethylene, you're going to get tibial rotation. And on the upper surface, you're going to get AP translation and flexion extension. So this just decouples the forces to utilize both surfaces of the polyethylene. So what are the benefits then of a rotating platform total knee? You'd expect to get reduced polyethylene wear because of this monodirectional wear pattern, which should harden the polyethylene in the direction of force. You should get, hopefully, an increased resistance against condylar liftoff. And you should be able to maintain your contact area in rotation, which should avoid these peak stresses in polyethylene. And hopefully you might improve AP kinematics as well, reducing some anterior femoral sliding because of the conformity that you can build into your components. So let's address these issues individually. Unidirectional wear patterns we've already seen in my previous talk on not all mobile bearings being equal, that in a rotating platform knee replacement you expect to get less wear. The osteolytic potential of the polyethylene debris is interesting to look at because you're going to get osteolytic debris, but it's the volume of debris that's generated is the key. You'll see that the size of the particles is similar, but the volume is less. Let's talk about an increased resistance against condylar liftoff. If you've got the ability to build in some coronal congruity in your knee replacement design, because you've uncoupled the forces, then that should increase the contact area and it should provide resistance against condylar liftoff. And again, this is not new data, this is old data. You'll see that in an LCS down here, that's pretty spectacular increase in contact area. So, the ability to decouple these forces then allows you to change the design of your component to accommodate. These are typical nurses that work in my hospital, and they're smiling and happy. So it just shows that all small things aren't good. And a mobile bearing will also maintain a contact area under rotation, and hopefully you're going to get a reduction of risk of spine wear in a PS design. Surgeons have often gone from CR to PS to try and increase their range of motion, and then gone back to CR again because they've seen spine wear. Perhaps if you consider using a mobile bearing PS design, you may not have to go back to CR. You'll see that the contact area is much bigger in a mobile bearing knee replacement than in a fixed bearing knee replacement. Seth Greenwald's work in 2005 in the American Academy. So what will happen, as you've seen from the earlier biomechanical slide, is that the polyethylene insert will follow the rotation of the femoral component in any rotating platform design, and it'll maintain the contact area under rotation. So you will not get the peak contact stresses above the 20 megapascals that will cause you concern clinically. Doug Dennis, I apologize that this hasn't come out very well, but Doug Dennis showed that in vivo that you will get 10 or even up to 15 degrees of rotation of the components in total knee replacement post-operatively, and that even in a fixed bearing knee replacement you will get some, but obviously that has to be accommodated on the upper surface of the polyethylene between the femur and the polyethylene surface, whereas this is going to be accommodated on the undersurface of the polyethylene. Hopefully you're going to get improved AP kinematics as well, because the mobile bearing design will allow this increased conformity in the sagittal plane, and it will reduce this paradoxical anterior femoral sliding that some people have seen in PS designs. And with better control over AP kinematics, you may then reduce wear rates further. We've already seen that deep knee flexion poses a challenge because the knee rotates more in deep flexion, and that reduced contact area will lead to increased polyethylene wear and potential spine wear. And a rotating platform design will maintain this large contact area under rotation. It will accommodate rotation and should really perhaps be your implant of choice for a young and active patient. You've seen that in an LCS, the long-term survivorship throughout maximized contact area and minimized polyethylene stress has actually been achieved in vivo by transformation of the shear forces into compression, which ensures long-term implant fixation. So in summary, with a total knee replacement, you have an issue of condylar liftoff, and the mobile bearing solution for that is increased coronal conformity and contact area. The issue of femoral rotation in high range of motion, the mobile bearing solution is to maintain contact area and rotation. The issue of paradoxical anterior sliding, the mobile bearing solution is increased conformity in the sagittal plane. There are concerns historically over mobile bearings. People worry about bearing spin out. People worry about the osteolytic reactivity of mobile bearing polyethylene debris. But in vivo, bearing spin out, though historic, perhaps is not such a problem now using better alignment and soft tissue balancing, using computer-assisted knee surgery. I've only ever had one bearing spin out, and that was in a valgus knee that I really perhaps shouldn't have put a mobile bearing in anyway, because the medial collateral ligament wasn't the best. And in recent publications, there's very minimal instance of bearing spin out. So in conclusion, wear of fixed bearing total knee replacements is highly dependent on rotation and displacement kinematics due to increased cross shear in the polyethylene. And a rotating platform mobile bearing knee replacement should reduce ultra-high molecular weight polyethylene wear under high kinematic load by decoupling the multidirectional motions of the knee and made them monodirectional motion at two interfaces, therefore reducing this cross shear and wear. The volumetric concentrations of ultra-high molecular weight polyethylene wear particles are similar for fixed bearing and rotating platform knee designs. The greater osteolytic potential predicted for fixed bearings is due to the increased wear rate. And highly active patients and those demanding high flexion may benefit from a rotating platform mobile bearing knee design. Thank you.